Is now a federal holiday. President Biden signed that legislation yesterday. The holiday commemorates the end of slavery in the United States. And joining us now to talk about the meaning behind this new holiday in terms of how it affects the healthcare industry, Sara Lewis, Vice President of Health Equity at Hartford HealthCare. Sara, thanks for being with us today.
Thanks for having me.
So talk to us a little bit more about what Juneteenth symbolizes for those who don't know what it is.
Sure. Juneteenth is a celebration of the end of slavery in the United States. It recognizes the day in June 1865 when enslaved people in Texas learned that the Civil War had ended just 2 months earlier and that President Lincoln had issued the Emancipation Proclamation 2.5 years earlier in January 1863. Enslaved people in Confederate states like Texas had technically been freed from bondage for 2.5 years but did not learn of this until the arrival of Union Army troops in June 1865 in Texas. I think that Juneteenth is a day for Black liberation, for Black people to feel the joy of liberation, a day for us to recognize all of the ways that we fight for and claim that freedom in a country that still marginalizes and systemically brutalizes us. And it's a day for us to honor all of our predecessors, whether they struggled under the whip, struggled in chains, struggled in the shadows, and never knew freedom, or if they fought for and lived progressively more liberated lives.
Why is it so important that healthcare professionals understand Juneteenth and its history?
It's really important for us to understand it because it's a meditation on collective and individual liberation. As members of a healing profession, we need to understand the significant trauma that stems from people living in a society built upon the systemic degradation and exploitation of Black people. That legacy pervades every aspect of American life and translates into real destiny-altering differences between what is considered possible and available to people based on the caste they're born into. We need to be honest and courageous about these truths because they affect the well-being of the people we care for every day. You know, for instance, Black people have lived on American soil for 400 years, and only recently, 56 years ago, did we earn a federally protected right to vote. And prior to the pandemic, for instance, Black families had just 12 to 14% of the average household wealth that white families did. And we know that this gap has widened even further during the pandemic. So it's really important that we understand the legacy that this history creates for people today.
So Juneteenth is tomorrow. What is Hartford HealthCare doing to honor the day?
So we are encouraging our colleagues to learn about and celebrate Juneteenth. We are watching different videos and reading about the history and talking about it with one another. Also, Hartford HealthCare is really proud to be the heritage sponsor for the Amistad Center for Arts and Culture's 30th anniversary Juneteenth celebration, which is taking place tomorrow. It's a virtual celebration of art, music, song, and, of course, freedom. So you can look at that up on their webpage.
Sara Lewis, the Vice President of Health Equity with Hartford HealthCare. We thank you so much for being with us today.
Thank you so much.